Now, for the next substance which we are going to talk about, that's its action as related to hypertension. Try to link it up with hypertension. We're not saying it causes hypertension, but we're just trying to say it's a contributory factor to hypertension. It's aldosterone. Okay, aldosterone. So this is aldosterone, and it's actually secreted from the adrenal gland. Okay, so how can aldosterone, probably when it is not regulated very well, contributes to hypertension? So it contributes to hypertension because if its levels are not regulated well, it leads to increased sodium and water retention in the kidney. You understand? So water and sodium that is supposed to what is destined to be put out of the body. If aldosterone is there, it will make it to come back into the body. So let's talk about it. Let's expand. We said that its first action is what? Renal sodium and water retention. So aldosterone acts on the distal tubules and collecting duct of the kidneys. So it will now stimulate these portions of the nephron to what? Any sodium that passed there and any potassium that passed there. Sorry, any sodium that passed there and any water that passed there will be brought back into the body. But if potassium passed there, it will be put out of the body. Do you understand? So it leads to a lot of water to be brought back into the body, a lot of sodium to be brought back into the body, and this increases the pressure in the body. So potassium regulation too. By promoting potassium excretion, aldosterone maintains electrolyte balance, but excessive activity can cause hypokalemia. Okay, so vascular effects beyond the kidneys, aldosterone also affects blood vessels. It promotes endothelial dysfunction. It stimulates smooth muscle cell growth and fibrosis, leading to vascular stiffening. Also increases oxidative stress and inflammation. Okay, so this is what we have. Okay, and we're talking at this level, the level of what? Aldosterone. So clinical relevance in hypertension is you can have primary what aldosteronism, where there's excess aldosterone and it causes a lot of hypertension, that's high blood pressures, and of course potassium will always be put out when there's aldosterone, so there's hypokalemia, so there's low levels of potassium in the body. Also essential hypertension, this one, subtle increase in aldosterone activity can contribute to elevated blood pressure and so on and so forth. Then also there's a risk of heart diseases. So they now make some drugs that can now be able to target this aldosterone and reduce its activity. So drugs like spironolactone and also what? Eplerenone. Okay. So those drugs can now be able to use and they treat hypertension that is possibly being caused by the high levels of this aldosterone.